Hello and welcome to World in 5. Authorities are facilitating drug procurement in a move aimed at boosting public health service delivery, responding to questions from legislators during a Senate question and answer session. Health and Childcare Deputy Minister Suleiman Kwidini acknowledged shortages of drugs and other essentials in major health institutions in the country. He, however, said measures are being taken to improve this situation.
It's very true that there are some shortages in our major hospitals of drugs. We have seen it increasing because the challenge now, our people, especially from cities, they are no longer receiving medical care where they are supposed to receive, especially in clinics which are run by the local authorities. But nevertheless, the ministry is working tirelessly to make sure these drugs are now going to be found in those hospitals, mostly because, as we all are aware, that we don't produce drugs in Zimbabwe. Mostly we do order drugs from outside, so we have placed orders. I think it's about first quarter of this year. We have procured drugs for the second quarter, so they are still on the way for delivery.
The Harare City Council is planning to demolish homes in 39 areas across the city. According to a leaked internal document, the areas affected include parts of Warren Park, Belvedere, Meborine, Glenview 7, and some parts of the Glen Lawn. The plan comes following recommendations from the Town Clerk's Office and the city's Regulation Task Force, which identified illegal developments on wetlands and spaces reserved for schools and recreational facilities. These
walls behind me lies the fate of thousands of residents whose properties are said to have been built on illegal grounds and now are set for demolitions. From 9 a.m. to about midday, the city fathers were locked up behind these walls, discussing the fate of these demolitions that are said to affect 39 areas around Harare. An internal memo, which we are in possession of, has confirmed this.
These areas include parts of Warren Park, Belvedere Ridgeview, Meborine, Glenview 7, and some parts of Glen Lawn. The city fathers acknowledged the leaked document, confirming it is a preliminary internal draft which is currently under review.
Its appearance in the public domain at this stage is premature, as it represents an administrative working paper formulated to facilitate the lawful regulation and enforcement objectives of the city. Residents are hereby informed that the City of Harare will undertake a process of verification and enforcement concerning illegal activities on council, state, and privately owned land within Harare's jurisdiction.
The Girls and Women Empowerment Network, an organization that advocates for the rights of girls and women, has constructed a study center in Seke district in a bid to empower the students with digital literacy skills. Our correspondent Mashudu Mambo, who was in Seke, gives us the details.
In the community of Seke, a remarkable transformation is underway, thanks to the Girls and Women Empowerment Network. The organization has been working tirelessly to empower girls and women, providing them with the skills and support they need to succeed. The Study Center is one of the initiatives launched by the Girls and Women Empowerment Network to support students in Seke. With digital literacy skills and educational resources, young women are now able to pursue their dreams and achieve their goals.
Study center ribatsira vana vedu pakuti vari kustada for free, even kunyora mahomeworks vachisearcha painternet vari kuita for free.
The United Nations Security Council has called on Israel to lift its blockade on Gaza, where food supplies are dwindling and the humanitarian situation continues to deteriorate. Addressing an emergency meeting of the UN Security Council on Gaza's worsening humanitarian crisis, Tom Fletcher, the UN Under-Secretary General for the Humanitarian Affairs, said the humanitarian situation in Gaza is deteriorating rapidly amid an Israeli blockade that has prevented the entry of food, medicine, water, and shelter materials for more than 10 weeks.
We have life-saving supplies ready now at the borders. We can save hundreds of thousands of survivors. We have rigorous mechanisms to ensure our aid gets to civilians and not to Hamas. But Israel denies us access, placing the objective of depopulating Gaza before the lives of civilians. The Israeli-designed distribution modality is not the answer. It practically excludes many, including people with disabilities, women, children, the elderly, the wounded. It forces further displacement. It exposes thousands of people to harm. It sets an unacceptable precedent for aid delivery, not just in the OPT, but around the world. It restricts aid to only one part of Gaza, while leaving other dire needs unmet. It makes aid conditional on political and military aims. It makes starvation a bargaining chip.
That's all we had in World in 5. Good afternoon.